One of the biggest leaps you can make as a practitioner that treats babies is to understand and accept that babies cry, and that's okay, and that's not actually a judgment on you. And so particularly if you're beginning this field or thinking of going into this field, you look, I'm not going to sugarcoat this, babies cry. You know, and sometimes they cry a lot during the treatment, but that's absolutely okay. And sometimes it's even better than okay, because sometimes when a baby is crying, that's an opportunity for a mum to see that the baby is crying with you and you're the professional, and it relieves that mum of so much guilt and burden around the fact that they can't get their own baby to cry. And there must be something wrong with them as a mother. They must be a failure as a mother because their baby won't stop crying. And so then when they see the baby crying with you, they're like, oh, okay. Especially if you take that opportunity to say, look, baby is okay, baby's crying, this is what's happening, and we're going to try and settle them, and it's going to be okay, and we're going to treat them, but they will cry. Rather than dropping into that kind of our own emotion, our own stuff, because it's actually not about us, it's about the baby. But of course, all the time as a practitioner, we're on the hook, whether it's treating an adult, whether it's treating children, you know, we're there and we're trying to do the best for the patient. And that ties into how we feel as healers. And often it can make us feel insecure if we feel things aren't going the way they should go. So particularly when you treat babies the first time, you can get into this little bit of this loop of, oh no, I'm no good, the baby's crying. Whereas actually, if you reverse that and think of it as an opportunity to unburden of mum of any guilt around this, then it's like, woof, this release with you, you start to relax, and then actually baby will often start to calm down as well. And so it's a little bit of a win-win with that. And it's just such a release when you can overcome that as a practitioner, and you can go on to do some amazing work with babies and really help that whole family dynamic, mum, baby, dad, whoever is in that extended family.